Hello everyone, I am Dr. Richa from Physiology Open and we are continuing our last lecture on pharmacokinetics. So in this video, we will mainly talk about half-life and the drug dosing regimen. So suppose if we have to give a drug by oral route and say at time point 0 we give the drug. So what is going to happen? How it will change the plasma concentration of the drug? See, as you administer, the drug will start getting absorbed from the site of delivery. Okay, so oral route means it will get absorbed from intestine and slowly the plasma concentration of the drug will start rising. Now, as the plasma concentration start rising, remember that elimination will also start. Okay, so at this point, what we see that rate of absorption of the drug is greater than the rate of elimination. Yes, some drug will also distribute into the various compartments as we have seen in the video on volume of distribution. So yes, it will also distribute, but making it simplified, like here rate of absorption is greater than the rate of elimination. That is why the plasma concentration is rising. Yes, it is also distributing. Then at some point it will happen that rate of absorption will become equal to the rate of elimination. That means the rate at which the drug is entering into the circulation and the rate at which it is being removed from the circulation, they become equal. So from now onwards there will be no rise in the plasma concentration, and as whole drug is absorbed, slowly this rate of absorption is going to decrease, because now the quantity which is available for absorption is itself less, right, and rate of elimination is more. So now the concentration of the drug will start falling. Okay, so in here when it is in the falling phase, rate of elimination becomes the rate of absorption. Okay, so basically when we are giving a drug, we want a steady state. The plasma concentration of the drug should be such that rate of absorption is equal to the rate of elimination, because we want that the drug should act at that particular level. Right. Now, how much should the plasma concentration reach? Suppose you are giving a certain dose of the drug. Now, whether the plasma concentration what it is reached, will it be useful for the patient? So the plasma concentration which we want the drug to reach is known as in between therapeutic window. Okay, so the plasma concentration of the drug should be acting on the patient. In that range we have to maintain the concentration of the drug. Okay, so maybe it is somewhere here. Okay, so that is known as minimum effective concentration of the drug, and if it increases above that, there will be a value above which there will be toxicity. So that is known as maximum effective concentration above which there will be toxicity. Okay, or we can say minimum concentration at which there is toxicity. So we want the drug concentration to somewhere here. It should be somewhere here. It should not go above, otherwise there will be adverse effects, and it should not be below, otherwise it will not be able to act on the patient. Right. So this concept is one thing. Now this I am talking about orally or any other route like intramuscularly, subcutaneously, because their absorption is taking place. But if we deliver the drug intravenously, in that case what is happening? We are directly injecting the drug and the entire 100% of the drug is in the circulation only, right? That we have discussed in the video on bioavailability, that whole drug is in the circulation. So the plasma concentration will be somewhere at the top. So at the time 0 itself, it is not rising slowly as we saw here in oral administration of the drug. Here there will be maximum concentration, and if we give one-time injection, we are not maintaining continuous infusion. So if we give one-time injection, after that there will be decline in the concentration of the drug. So again here, now the drug is getting eliminated, and after some time it will become 0. After some time it will be eliminated from the body. Now we have to determine what is the rate of elimination of the drug. Okay, so that is determined by the slope, by this slope. Actually we want to know the fraction of the drug which is eliminated per unit time. Okay, so we have seen in previous video where we talked about first order kinetics and zero order kinetics. So in first order kinetics we see that a constant fraction of the drug is eliminated from the body per unit time. right? So that constant fraction which is eliminated per unit time, that is known as K. Okay, K is constant fraction of the drug which is eliminated per unit time. So how to calculate that? See, we will take some concentration, right? So here we will take C1 minus C2. What is first concentration? Maybe C1. Here it will be C2, and then we divide with the original concentration. So that will only give you the fraction. Okay, so that is fraction per unit time. So this time, okay, and this time we have to take, so that we take T2 minus T1 because T2 is more, isn't it? So time 2 is more, so we are writing as T2 minus T1. So this will give us the fraction of the drug which is eliminated from the body per unit time, and that is known as rate constant of elimination, or also known as K. Okay, now we can also write this K as rate of elimination divided by the amount. Okay, see, rate of elimination is what? If we write this thing C1 minus C2 divided by the time, this is the rate of elimination, and this C1 is the original amount. Okay, so if we talk about the whole drug, here we are talking about, okay, at one point of time, now how much is the fraction eliminated? So we have taken this C1 first value, but if we talk overall, then we can write as rate of elimination divided by the amount. So that is also is equal to K. Right? Now from this K we can determine the T half, right? So this K we have said is fraction eliminated per unit time. So we can also write it as dC by dt. Okay, so that is delta change in the concentration divided by the delta change in the time, and this has been multiplied by original concentration of the drug. Okay, so by rearranging, I'm not going into the detail of all this thing, by rearranging everything, taking log of the equation, we finally reach to the equation that if this T is equal to the T half, that is the time at which the concentration of the drug is halved. In how much time the concentration of the drug is halved? Okay, so that T half, if we take, it will come to log 2 divided by K. So I am not going to solve this entire equation, and it is not necessary also, but this equation you should remember that T half is equal to log 2 divided by K, where log 2 if we calculate, it will come to 0.693. Okay, so T half is equal to 0.693 divided by K. Now before we have seen that K is equal to rate of elimination divided by amount. Okay. Now if we multiply this rate of elimination divided by amount by plasma concentration of the drug, so we are taking numerator also plasma concentration and denominator also plasma concentration, then you see that this rate of elimination divided by the plasma concentration is equal to the clearance. Okay, rate of elimination divided by plasma concentration is clearance. This again we had seen in the previous video, where we saw that clearance into plasma concentration is equal to the rate of elimination. This we had seen in the previous video. Okay, so this clearance will be what? This PC will go down. So rate of elimination divided by the plasma concentration is clearance. Similarly, this amount divided by the plasma concentration is volume of distribution. Again, this we have seen in the previous video, that when you give a drug amount, if you give a drug, then it enters into the body and it distributes into various compartments. So this amount is equal to volume into concentration. That means after distribution there will be a plasma concentration which will be reached. So this amount is equal to volume in which the whole drug is present, multiply it with the concentration, it will give you the total amount, right? So this C, this is the concentration. If I bring it down, amount divided by C is what? Is volume of distribution. So here K, what we wrote as rate of elimination divided by amount or fraction elimination per unit time, that we can also write now as clearance divided by the volume of distribution. So fundamentally what we are saying, that this T half, which we had written as 0.693 divided by K, now we can rewrite it as 0.693 divided by clearance multiplied by VD, because K will be here, right? And K is equal to clearance divided by volume of distribution. So conceptually, you have to remember that this T half, that is the time in which the drug concentration becomes half of the original concentration, that depends on clearance and on the volume of distribution. Okay. More the clearance, less will be the half-life, right? That means the drug is being eliminated from the body faster, right? Now, when we give this drug, when we give a drug, what happens that it reaches a steady state concentration. How? See, what happens that as you give a drug, say suppose I have given one drug like this, say suppose I give 2 grams of, let me change the pen, okay? So say suppose if I give 2 gram of the drug, okay? Now what will happen, it will reach, say suppose for the sake of simplicity I am not talking about the concentration and all, say suppose here it is the value of the drug is 2 grams within the body. Now depending on its T half, say half life is 4 hours, right? What will happen, within 4 hours it will come back to 1 gram, right? Because the concentration is halved, and concentration halved means that the amount also is halved. So from 2 grams it becomes 1 gram. Now again I give 2 grams. So I have now added more dose. I am repeating the dose. Here when we talked about single dose only. Now I am repeating the dose. So if I add 2 grams more, what will be the dose? Say it reaches 3 grams. Okay. And then again after 4 hours, so this is 1 4 hour, I will write as T half 1, right? And then after 4 hours, it will come to how much? It will come to 1.5 grams. Okay, again I add 2 gram, what will happen? It will come to 3.5 grams. It will reach to 3.5 grams. Again you half it, right? So this is T half, 2 T halves will be there. So it is 8 hours. Here it will be 12 hours. Again it will have, how much it will be? It will become some 1.75, right? So you see, as the drug concentration is increasing or the drug amount is increasing in the body, because it is the constant fraction which is eliminated. Here it is 50% because we are talking about half-life where the concentration of the drug is halved. Okay, so the amount of the drug is also halved. But what is happening, as we are adding the dose, you see the elimination amount is also increasing. So ultimately what will happen, after around 5 half-lives, about 4 to 5 half-lives, rate of administration will become to the rate of elimination. Okay, because we are seeing that as the drug amount is increasing, the amount which is being excreted is also increasing. Okay, fraction is constant but the amount is increasing. So at this point, after around 5 half-lives, it reaches a steady state. That means now it is not going to change. It will be like this, up and down. It will continue in this particular range. Okay. Now this peak level, that is known as crest, right? So let me rub this, clear it little bit. So we'll redraw this. Okay. So this peak level which reaches, say here, okay, we have to draw like 4 half-lives, 5 half-lives, and it is maintained here. So that is after 5, approximately 4 to 5 half-lives, and this peak concentration which is reached, that is known as crest, and this lowermost concentration which is reached, that is known as trough. Okay, and this we are talking for a dosing where we are giving either oral dose, intramuscular dose or subcutaneous dose. We are not talking about IV infusion, continuous IV infusion. Okay, here the dose is being repeated again and again, right? So suppose if there is a hypertensive patient and you are giving a drug, so with single dose only, you see the drug may not be effective. You have to repeat the dose, and after 4 or 5 doses, what we are seeing that the drug has reached a concentration within the therapeutic window. So just by giving one dose, it may not be efficient for controlling the blood pressure, right? So this is crest, this is trough. Then 4 to 5 half-lives, it will reach a steady state concentration. Now this steady state concentration, the time it takes to reach this steady state concentration, it always depends on the half-life. How much dose you are giving, that doesn't matter. The time to reach that steady state concentration. However, how much dose you are giving will determine that what is the steady state concentration, what is the steady state concentration. Suppose if I give more dose, so same thing now I will have to draw like this. Okay, but a steady state it will reach in the same time, but the concentration which is reached, it is much more, right? So this fluctuations plus the steady state concentration, how much up it is going, how much down it is going. It depends on how much dose you are giving and at what interval you are giving. Understanding? See, steady state concentration, at what time it will reach, it depends on the half-life. Whether you give more dose, less dose, doesn't matter. What concentration it will reach, that is different. But at what time it will reach, it depends on the half-life. Okay, so that's what I have drawn two different curves. But how much dose you are giving, that will determine that what level it is reaching. What is the plasma concentration at steady state, right? Third, if you are infusing the drug, you are giving a continuous infusion. In that case, what will happen? This up and down, the crust and trough will not be there. The drug concentration will rise and then it will reach the steady state, but it will be the same time again, and then it will maintain here. Understanding? But the concentration, but the time taken to reach the steady state will be the same, that is 4 to 5 half-lives. Understanding? Why? Because when you are infusing also, it is getting eliminated by the body, isn't it? So after 4 to 5 half-lives, steady state will reach and it will be maintained. It is not going up and down when it is continuous IV infusion. That means you are giving the drug continuously. Okay? Now, how much drug to give? That depends on the therapeutic window. What is the plasma concentration of a drug you want to achieve? Okay, so that is known as maintenance dose. Okay, we want to achieve this steady state concentration. So this maintenance dose depends on the rate of elimination. Right? So we want the rate of administration should be equal to the rate of elimination. That is the steady state concentration that we have seen. So this rate of elimination, again we have seen before when we were talking about K, this rate of elimination is equal to clearance into plasma steady state concentration. So we know about the therapeutic range of the drug. So we know that, okay, what will be the plasma concentration which we want for that particular drug. Okay, so that we will know and we will multiply it with the clearance, and that will give us the rate of administration. That means how much amount of the drug we should give per unit time. Okay, so like in full day, how much amount of the drug we should give, right? Now this you can break. You can give like same drug twice, but like you can give smaller doses twice, or you can give single dose for full day. That again depends on the half-life of the drug. So let us see certain examples for that. So I'll just rub it again. How there will be variation that if you give one large dose and if you give smaller doses. So suppose I give a very large dose of the drug. Maybe with single dose it will reach up like this and then it may come down. Right? So I am seeing that, okay, for both we have a half-life, T half, let us see as 6 hours. Okay, so it comes down in 6 hours to half. Then again I give one large dose at T half. So every 6 hours I am giving, right? So I'll give and again it will come back here, and then again I give and again it comes back here. Okay, so what we see that every 6 hours these are the fluctuations. Now what I do, same drug, I decrease the dose, I half the dose and I give it every 3 hours. Okay, what is going to happen? Again it will go up down like this, and again in 4 to 5 half-lives it will come here. But for this, what is going to happen? You see the fluctuations are more. It may be something like this, right? Or even if it is here in therapeutic window, it may be something like this, right? So basically what amount of dose you have to give and at what time you have to give, that depends on the half-life of the drug, your dosing interval. Now suppose I am telling that every 3 hours if you give, the drug is maintained in this window. It is very good. But asking the patient to eat a drug every 3 hours, it is very difficult, right? Best recommended is for any drug, okay, once a day if it is given, it is fine. But we see that when we increase the dosing, then what is happening? The fluctuations are increasing, isn't it? So that also we have to decide based on the how long we have to give the drug. If it is like a chronic treatment, then once a day is fine. Otherwise, depending on the disease, we have to give the drug. Okay. Now, what about that if there is a disease for which we need to control it fast? here you are seeing that steady state concentration within the therapeutic window, even if we target like this, then it is reaching in 4 to 5 half-lives. But maybe that there is a disease which we need to control very fast. We can't wait for 4 to 5 half-lives. Then what to do? Then we have to give a loading dose of the drug. So we have to determine a dose such that very fast the drug reaches this level. Okay, and then after that we can continue with the maintenance dose so that the drug is maintained at this level. So with a single dose we target that it reaches within the therapeutic window and then it is maintained. So for such conditions, for example, if we are using antiarrhythmics or we are using anti-epileptics, because we can't wait for like 4-5 T halves, because if in the meantime the patient gets a life-threatening arrhythmia or he gets epileptic attack again, then it is not good for the patient. So we have to give a loading dose. And how to calculate this loading dose? Loading dose doesn't depend on clearance. In turn, loading dose depends on this volume of distribution, and then we multiply with the plasma steady state concentration. So whatever concentration we want it here, we will multiply it with the volume of distribution, because when you are giving the first dose, what will happen? As the drug enters into the body, it will go into various volumes. Okay, so we have to determine that after distributing into the various volume, the concentration which is achieved in the blood is equivalent to that of the plasma steady state concentration which we want. Okay, so loading dose doesn't depend on the clearance. Okay, it depends on the volume of distribution, and after that you give the maintenance dose as is required, right? Now before we finish, just final thing, that here I talked about maintenance dose depends on clearance. See, same formula is there, except in maintenance dose, clearance is replaced by volume of distribution in loading dose, right? But if you are giving the drug orally or by any other route apart from intravenous route, you have to divide this by bioavailability as well, right? Because that is the amount which is going to reach into the body, right? So please remember, if it is IV, no need to divide because there will be 100% bioavailability. For other routes, you have to divide by bioavailability, that is denoted by F. Okay, so that was about the half-life of the drug and also the drug dosing regimen. Only last thing you remember here, that when we stop the drug, then also after stopping the drug, it will take 4 to 5 half-lives for the drug to get eliminated out of the body. So you can work out the maths yourself, that how if it is being eliminated and after each T half 50% is eliminated. Say suppose initially 2 gram of the drug is there, then after 1 half-life there will be 1 gram of drug, then after 2 half-lives there will be 0.5 grams of drug, and after 5 half-lives we see that approximately 97% of the drug is eliminated from the body. Okay, so with this we complete our pharmacokinetic series. In the next lecture we will start pharmacodynamics. Thanks for watching the video. If you liked it, do press the like button, do share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you.